In the course of one day, over 8,000 liters of air meet 8,000 to 10,000 liters of blood pumped through the heart through the pulmonary arteries. This oxygen is used to metabolize fuels such as carbohydrates, proteins, and lipids, and produce carbon dioxide. The lungs are also very important to protecting the body against infection and harmful environmental toxins. Because of these factors, it is clear that nutritional status and pulmonary function are interdependent. However, 1 in every 6 deaths in America are related to lung disease. The third leading cause of death, asthma and chronic obstructive pulmonary disease, also known as COPD. This presentation will be dedicated to defining COPD, determining preventions and interventions for patients with COPD. We will also be reviewing a case study. COPD is defined as a disease that limits the airflow in the lungs through either inflammation of the lining of the bronchial tubes or destruction of the alveoli, with symptoms of dyspnea, which is shortness of breath or difficulty breathing. COPD is often accompanied with emphysema, which is a condition characterized by thinning and destruction of the alveoli, resulting in decreased oxygen transfer into the bloodstream, as well as shortness of breath. The quality of life for a person suffering with COPD diminishes as the disease progresses, resulting in the inability to work and possibly limiting their day-to-day physical activity. Malnutrition is also common in individuals with COPD. As efforts to breathe increase, their food intake may decrease. Often individuals with COPD eventually require supplemental oxygen, and they may have to rely on mechanical ventilation. Chronic respiratory diseases lead to increased heart work, and cardiac complications of COPD include cor pulmonale, which is induced by high blood pressure in the pulmonary arteries, affecting the right ventricle of the heart, and COPD also places a higher risk of left ventricle failure. The quality of life for a person suffering with COPD diminishes as the disease progresses, resulting in the inability to work and possibly limiting their day-to-day physical activity. Malnutrition is also common in individuals with COPD. As efforts to breathe increase, their food intake may decrease. Often individuals with COPD eventually require supplemental oxygen, and they may have to rely on mechanical ventilation. Since breathing requires more energy, the respiratory muscles need to generate a larger force to expand the thoracic rib cage, and that increases the resting energy expenditure, also known as hypermetabolism. Maintaining optimal energy balance in individuals with COPD is essential in order for them to preserve weight, lean body mass, and a general well-being. Adequate intake of protein is between 1.2 and 1.7 grams per kilogram of body weight. As for calories, energy requirements are between 25 to 30 calories per kilogram, with 20% of the calories coming from protein. Helpful tips to give COPD patients are to advise them to rest before eating meals so they won't become fatigued, and eating small, more frequent meals rather than 3 large ones, which may alleviate fullness and bloating. The case study for COPD is on Louise Hoffman, a 62-year-old woman with a height of 5'3", and she currently weighs 119 pounds. Her usual body weight is between 145 pounds and 150 pounds, and her last recorded weight was taken about a year ago, and she weighed 139 pounds. Her ideal body weight is 116 pounds. Mrs. Hoffman's temperature, respiratory rate, and pulse are normal. Her blood pressure, however, was elevated. Reflecting on her history, she used tobacco for 46 years and quit smoking a year ago. Members of her family have died from lung cancer, including her mother. 5 years ago, she was diagnosed with stage 1 COPD with emphysema. Emphysema is an overabundance of air trapped in the lungs. She also has a history of bronchitis and upper respiratory infections. Mrs. Hoffman reported it is hard for her to do things by herself. She requires much assistance from her husband. She often finds herself gasping for air, and her husband also reported that in the mornings she's very confused. Reviewing her labs, carbon dioxide and bicarbonate are elevated, caused by a pH imbalance linked to signs of kidney disease, respiratory, or metabolic disorder, such as COPD. Her anion gap, protein total, prealbumin, and albumin are all low, an inherent link to malnutrition. These symptoms include lightheadedness, fatigue, drowsiness, shortness of breath, and inflammation. When looking at her white blood cell count, it's elevated. Her red blood cell count is low. Her hemoglobin is low, as well as the hematocrit. These are all signs of anemia caused by malnutrition. Symptoms include fatigue, shortness of breath, weakness, and tiredness. The level of lymphocytes and SEGs, which is nymphocyls, a form of white blood cell, are elevated. These are linked to signs of infection, normally seen within conditions of anemia. Reflecting on her carbon dioxide and oxygen, her carbon dioxide is elevated and her oxygen is low. This is related to COPD because of the damaged cells and emphysema. Interpreting the purpose, side effects, and interactions of her medications are important understanding, as well as when prescribing diet order. Solodrum is for allergic reactions with side effects of nausea, vomiting, and heartburn, change in appetite and sweating, with adverse effects, food effects of grapefruit. Ansef is to treat or prevent serious bacteria. It's an antibiotic, and it can cause loss of appetite, vomiting, nausea, headaches, and diarrhea, and they advise for a sodium restriction due to the high content of sodium in the patient. The IV was administered to replenish fluid and electrolytes, which can cause fever, increase blood plasma, and redness, infection, or swelling. It should be administered by a medical professional. Albuterol sulfate is administered to prevent and treatment of wheezing and shortness of breath caused by breathing problems. The side effects include nervousness, dizziness, shaking, and headaches, and may cause an increase in blood pressure. Combivin is used to treat COPD. It is a bronchodilator. Side effects include headache, dizziness, nausea, dry mouth, shaking, nervousness, and cold-like symptoms, with adverse food interactions only being soybeans. Ipratropium bromide is used to control and prevent symptoms of ongoing lung disease. Effects also including dizziness, nausea, upset stomach, along with constipation. And nausea cannula is just to deliver oxygen to the patient. Most of her medications have side effects that include appetite change, nausea, or dizziness, which may be contributing to her morning confusion, decreased appetite. When talking about her food recall, most of the food in her house that she eats is acquired from her because she does the shopping and her daughter sometimes helps. She does say it's hard to find meals, and when she does eat, she's tired and is only able to finish about 25% because she has to fix the meal and then eat it, and that takes a lot of energy. She also says food no longer tastes good, and her dentures, since losing weight, loosely fit. The only food she tries to avoid is milk to decrease mucus production, and she did state that food no longer tastes good. Reviewing her food recall, she intakes a lot of caffeine, high sugary foods without not calorically dense or rich in nutrients, and her diet is high in sodium. With her lack of liquid intake, decreased circulation of oxygen, may be a factor in her edema. The doctor requested an x-ray of her chest as well as an ABG, which is an arterial blood gas sampling due to her abnormal bicarbonate levels, elevated CO2, and low oxygen. Nutrition physical findings in her skin was that it was pale, warm, dry, and it had edema. Within her chest, there was wheezing, percussion, hyperresonant, caused by emphysema. Her nutrition diagnoses include inadequate energy intake related to poor appetite and dyspnea over the past year as evidenced by caloric intake less than estimated requirement. Inadequate oral intake related to lack of energy to shop and cook as evidenced by 20 pounds of weight loss. Inadequate protein intake related to decreased appetite as evidenced by decreased immune function, chronic infection, less than 20% of daily intake of protein as evidenced by low protein levels, elevated white blood cells, and low red blood cells. Knowledge deficient related to lack of prior nutrition-related education regarding COPD as evidenced by reports of not receiving any previous nutrition therapy. As we discussed ways to increase her daily intake, she agreed to introduce at least one chocolate boost into her daily routine to increase caloric intake, as well as try to eat smaller meals throughout the day and have them pre-prepared with the help of her husband. Future goals for this patient will be to increase fruit and vegetable intake as well as more fiber, and incorporate physical activity once her energy increases. To track these goals, I will monitor her weight, her level of edema, as well as monitor her intake by asking her to circle how much she eats on a plate diagram. To ensure that these goals are making an internal change, I will continue to monitor her lab values.